This week on the BackTable podcast.
I felt terrific. I went home after they deemed that I was good enough to go home, and I had no side effects whatsoever. I took my pills that he gave me. I think they were steroids, and I felt wonderful. I had no nausea, no nothing. It was the easiest thing I had ever been through, and I would highly recommend it to any patient who is a candidate for the SIR spheres. Simple, simple, simple. Now, some people do have issues. I'm blessed that I did not have any issues whatsoever.
So hello and welcome to the BackTable podcast, your source for all things interventional and endovascular. I'm your host, Eric Keller, an interventional radiologist in southeastern North Carolina and a board member of the Interventional Initiative, which is a nonprofit devoted to raising awareness of and access to these minimally invasive image-guided procedures. So today, rather than chatting with someone about performing one of these procedures, we're instead going to talk to someone who had a procedure about their experience to raise awareness among the general public about these life-changing options. So today we have Suzanne Martin, who is a stage 4 colorectal cancer survivor who underwent radioembolization with SIR spheres with Dr. Charlie Nutting, who I believe is at Image-Guided Therapy, which is an office-based lab out in Colorado now. So she was kind enough to come on the show and share her story with us. So thank you very much, Suzanne, and welcome to the BackTable podcast.
You're welcome, Dr. Keller. It's nice to be here. Alive and well.
Well. So why don't we go back to before you had this procedure? How did you first learn about interventional radiology and this even being an option? How did this come across your path?
I learned about this through my oncologist. I had never had an interventional radiology procedure before that. And the first procedure that I had done was I had my port put in by an interventional radiologist, Dr. Nutting. And after that, I was looking for a support group in Denver. And I came across a support group called Say Yes to Hope. And I became fast friends with the founder, Suzanne Lindley, and she put me in touch with Charlie Nutting, who I had already met, regarding a SIR spheres procedure. So after he put my port in, he told me that he had a procedure that some of his liver cancer patients were using, and he would check my records to see if I could be a candidate for that procedure. So I talked to my oncologist about it, and he said, let's let those tumors that have metastasized to your liver, let's try and get them smaller before we go into something like that. So that's how I found out about doing that particular procedure, the SIR spheres.
So in a way, you kind of referred yourself in a way. I mean, you had the port with Dr. Nutting, but then it was actually through this other organization that you learned about and actually came back to him in that way.
Right.
Rather than your oncologist like bringing it up to you, I guess. Or
he did not bring it up to me. I'm not sure if he ever heard of SIR spheres. A lot of oncologists have not heard of SIR spheres, which I think is criminal, because that procedure saved my life. I would not be here if it weren't for the SIR spheres.
Well, I definitely want to hear about that as well.
All right.
But before we get to the procedure, I guess, so you talked to Dr. Nutting again, he checks you for this, but then you said when you talked to your oncologist, they wanted to do like chemotherapy or something to shrink it before.
Yes.
Okay, so is that what?
Yes, he did targeted chemotherapy, targeting just my liver. I was not on systemic chemo. I think if he had put me on systemic chemo, that would have killed me. I had a horrible experience from chemotherapy. I had it in 2012, and I call that the year from hell. I was never so sick in my entire life. And actually, I had a fistula that an interventional radiologist in Colorado Springs performed on me. And he got all of that bacteria out, and I was on IV antibiotics for a long time. And then it just cleared up, and I was able to return to chemo and radiation. So I've had several meetings with different interventional radiologists.
Well, all sounds like a rough year, like you said, a year from hell. I mean,
It
everything that
was.
you went through, so you'd already had that kind of bad experience with chemotherapy before. You have this targeted chemotherapy. And now you're referred to talk about this, the SIR spheres, the radioembolization. So what was that like? You show up did you meet with Dr. Nutting again to talk about it first? They decide you're a candidate?
Yes, I met with Dr. Nutting. I took my daughter-in-law with me, and we talked ad nauseum. He drew diagrams for me. I was a little scared because he was going to go through my hepatic artery. So he put me at ease, said that, he had done thousands of these, and I'm probably exaggerating, but I had full faith and confidence in him. I went in on a Monday, and he went through my hepatic artery, and he did a procedure that they call mapping, which I'm sure you're familiar with. So he did the mapping, and then 2 days later, I went in and he did the SIR spheres, and he did it in both lobes of my liver. I have to stop and take a drink of water.
Oh, no worries. While you're taking that sip, I was going to ask, what were those experiences like in terms of, what went well, what was more challenging with those two parts of the procedure, the mapping and the delivery, actually giving the little radioactive beads?
The most difficult part of getting the radioactive beads was lying flat for, I think it was 6 hours after the procedure.
Wow. Okay.
That was the most difficult part.
No, it wasn't the procedure itself. It was the...
Absolutely not. He gave me, I don't know, probably Versed. I don't remember. It's been so long ago. And I think I slept through most of it. I was not aware that there was anything happening to my body, so I think that Versed worked perfectly. And when I woke up, I felt terrific. I went home after they deemed that I was good enough to go home, and I had no side effects whatsoever. I took my pills that he gave me. I think they were steroids. And so I took those, and I felt wonderful. I was dating someone at the time, and he came over that evening and fixed me some dinner. I had no nausea, no nothing. It was the easiest thing I had ever been through, and I would highly recommend it to any patient who is a candidate for the SIR spheres. Simple, simple, simple. Now, some people do have issues. I'm blessed that I did not have any issues whatsoever.
Particularly with treating the whole liver, I guess. I've found that sometimes when you're treating more real estate, particularly if you did both lobes of your liver at once, those people tend to have a little bit more of that, the side effects of it. Like if they talked about the post-embolization syndrome, like feeling like you had the flu for a few days, stuff like that. But it sounds like you didn't have anything.
I had nothing. I think I was up and, moving around doing my normal things the next day.
Wow.
So much easier than chemo, I'll tell you.
Sounds like it. Particularly your bad experience back in 2012, eh? So.
Yes. I had a very dire prediction that my oncologist told me I would probably live for 2 years, and he would try to get 5 years for me before I would die from the metastatic colorectal cancer. And he was wrong.
And good.
He was very wrong.
Very wrong. And that's a good thing. So that was in 2012 that he was saying that, the 5 years from 2012?
Yes,
Okay.
yes. And I had the procedure, the beads put in 2014 in the summertime.
Wow. So 10 years ago.
Yes. And I'm, as you can see, alive and well and smiling and living out my golden years. So it is amazing.
What was the follow-up like afterwards then? Did they do, they do this procedure, you're feeling fine. Did they then do a scan in like 3 months or something like that?
Yes, they did do a scan, and it was in 3 months, and the spheres had killed two of the largest tumors, and it had stunted the growth of the remaining tumors. So he kept me on chemotherapy for 1.5 years after that. And on December of 2015, my oncologist called me and he said, "You are a Christmas miracle. We cannot find any evidence of any disease anywhere in your body. You are completely free of cancer." So I didn't even go in for my chemotherapy. I just hung up, and that was it. That was the end of it.
Got your port removed? Or
No, after my 2012 adventure with chemo, my doctor, my oncologist, told me I was NED. So I had my original port removed. And then when I moved to Denver to continue my chemotherapy, that's when I had my new port put in by Dr. Nutting. So this is port number 2, and I don't ever want to get rid of it.
so you still
had
have
a
it like
friend-
10 years later?
I do.
Oh, okay.
Yeah.
Alive and
Yeah.
well.
I don't know if you can see that or not. Yeah, but it's there, and I get it flushed once a month, and so it stays in good working condition. I have a friend who had a port removed, and a piece of it broke off, and yeah, it went to her lung, and so she's no longer with us. But anyway,
Wow.
you could probably edit that out because that's not a very happy story.
Well,
Not a very happy ending.
well, but I think in our interventional radiology, sometimes, we think of ports, like putting ports in, taking them out as this very small procedure relative to like the radioembolization that you had. But, you take for granted the fact that those procedures can have real complications like that. And so you need a healthy amount of respect for those procedures as well.
Absolutely.
And the impact they
Yeah.
can have in someone's life,
Sure. Yeah, she got dead because of it.
Yes.
So that wasn't very pleasant for her family.
Oh, I'm sorry to hear that.
I also had an interventional radiologist microwave 2 liver tumors that came back after my spheres. And once again, easy peasy, in and out, no problem. 2 separate occasions. He put me out with something. I assume it was propofol, but is that the Michael Jackson drug?
Well, it's definitely one that's used in anesthesia a lot to make you a little deeper than just like the fentanyl and Versed.
Yes. And so he put one in and microwaved it, and then a couple of years later I had another one pop up, and he put the wire in for the second one and microwaved it, and I had no trouble after either of those procedures. My primary care doctor told me that I was really blessed because there are a lot of people that have problems after they have their tumor microwaved, but I had none, not a single problem.
And was that Dr. Nutting as well, or someone else then?
That was Dr. Montgomery.
Oh,
yes.
okay.
Dr. Nutting was in Colorado, and I was in Florida. I live in Florida now. So
Got it.
I have a whole new set of doctors.
And how did you come across on the microwave
with.
ablation then? Did you also kind of self-advocate for yourself, as well, or did someone recommend it to
I
you?
did. Well, my oncologist sent me to a liver specialist, and he said there is no way to get that tumor except through abdominal surgery. I had already had a liver resection, and it was the most painful, horrible recovery. Oh man, I mean, it just took weeks before I started feeling better. I was in excruciating pain. And I told the liver surgeon, I said, I'm not going to do that again. I'll just go ahead and die. And that's when I talked to my oncologist, and I said, I'm not going to do that again. And he said, well, why don't we call Dr. Montgomery, the interventional radiologist, and see if there's something he can do for you. And that's what we did. And he is the one that offered the microwave ablation. And I had that done and haven't looked back since.
And same thing. Sounds like no complications. You went in, you kind of fall asleep, you wake up, not even pain. Sometimes with my patients, maybe I'm not as good as Dr. Montgomery is what it sounds like.
I'm sure you're perfect, Dr. Keller.
They can have some pain afterwards, particularly if it's kind of near the edge of the liver and stuff like that. But it sounds like that wasn't the case for you.
Mine was at the very top
of
the liver. So I don't think it was easy to get to. I don't know. But you have a surgeon telling you the only way you can get to it is through abdominal surgery because of its location. But I guess I proved him otherwise because we got it. We got both of them. And if I have to do it again, I expect the same results, that he'll go in there and just zap it and I'll live a healthy, happy life like I've been living.
That's the exact word I use when I talk to people about it, is zapping it. So.
Yes, nuking it, so to speak. Yeah. So
go ahead.
I'm just going to say mine is a very, very happy story. Very happy story.
Well, and I think, you owed a lot to yourself, it sounds like, throughout this one of the themes of this story that I guess I'm hearing is that you had to ask for a lot of these procedures, or at least challenge the initial thing that you were offered. And I just wonder how we can change that in the future for other people, because not everyone is such a good advocate for themselves as you are. And I don't know the answer to that.
I don't either. Maybe this podcast someone will watch it and say, hey, why am I going through all this horror if I don't have to, if I can just have a simple procedure to help me? So I encourage people to advocate for themselves. When I was going through my initial chemotherapy and radiation, I was single. So I had no choice but to advocate for myself. And I moved to Denver, and same deal. I was still single, and I had to be my own advocate. I had no one else that could advocate for me except my two boys and their wives, and they don't know anything about chemotherapy. That's why I was so blessed to Say Yes to Hope and Suzanne Lindley. She's the one that told me about the SIR spheres. And then once I met Dr. Nutting, I put the two together. And so I thought, well, okay, this is what I'm going to do. So that's what I did. So it's just been an amazing journey. Started out horrible, but everything is amazing that's happened to me. I consider myself a miracle. I don't know that many people who have lived as long as I have with such a dire prediction, and in and out of the hospital with infection upon infection and off and on chemo, and just an awful situation. So I'm very, very blessed. And I got married 7.5 years ago.
Congrats.
And I know I'm living the best life ever.
Living the dream.
Yes, I live in the Gulf of Mexico in Florida.
Yes.
And it's beautiful here. I've got the best sandy beaches in the world. It's called the Emerald Coast because the water is so beautiful. I'm a very happy person. And I owe it all to that Charlie Nutting. If he hadn't set me on the right path, I don't know where I'd be today, but I wouldn't be here in Florida. I can tell you that much.
Well, we'll definitely put kind of links to his practice in the show notes too. So,
terrific.
Kind of like you were saying, the hope with this is that it will reach more people so that they can advocate for themselves. And then if they happen to be in Colorado or want to go there, then I have nothing but good things to say about Dr. Charlie Nutting, as I'm sure it's the case with you as well. It sounds so.
He's wonderful. When I lived there, I had a townhouse, and I had one of the ladies that I met at the Oscars come and stay with me so she didn't have to go get a hotel or a motel room. And I drove her over to get her spheres, and she did very well. He is an amazing, amazing doctor. I just love him to death. And we still stay in touch.
Really? I was gonna ask that.
Do.
Yeah. So what do you like check in with each other every so often, or?
Yeah, every so often. And I am fortunate enough, I go around the country. I call myself an amateur motivational cancer speaker. And there are people that will ask me to come to different groups and give a talk, which is, I thrive on that. I love encouraging people. I'm going to do that in Texas next month. And I love encouraging people to please advocate for yourself. And I share my story, and I have a lot of fun and get silly and get a little crazy when I'm doing it. But it's so much fun. So if you know of anybody, Dr. Keller, that would like to hear a story of miraculous hope, then let me know. You've got my information, and I would be more than happy to go to that particular meeting of interventional radiologists or nurses and talk to them. I can do it in person, which is the best way, or, through a Zoom call or whatever.
Deal. I need to take you up on that.
All right. I hope you do. I really do.
Well, I guess I wanted to ask you what advice that you have then, either to other interventional radiologists or people becoming interventional radiologists, or also patients thinking about this kind of based on your experience. What advice would you tell people?
Well, obviously, patients should advocate for themselves. Ask their oncologist if they know about spheres, or if they know about, there may be other procedures out there that I don't know about. If their oncologist can recommend an interventional radiologist that patient can then speak with. I would also advise oncologists to dialogue with an interventional radiologist, their own interventional radiologist, about procedures that can help liver cancer patients and patients who have metastasis to their livers. I think I'm not sure if my doctor, I don't think my oncologist knew about this procedure. I think he had to talk with Dr. Nutting first. And oncologists and interventional radiologists need to be in contact with one another when someone with liver mets or liver cancer comes to them for help. Did that sound right?
I completely agree. I always say that medicine's a team sport, and we all have
absolutely
our expertise, and it doesn't make you not as smart or anything else. There's too much to be familiar with everything. It doesn't make you less of an oncologist or something like that. It's having the intellectual honesty to say, okay, I contribute this part to this person's care, but there are other specialties that also have a lot, and being open to that in those conversations is everything.
I agree wholeheartedly. So I'm just blessed to be here, happy to be married, happy to have a husband that can help me advocate for myself. I'm due for a PET scan here pretty soon, so prayerfully that will all turn out the way I want it to. So we'll see. We'll see how things go.
Well, I wish you the best of luck.
I have a very deep faith walk. And when I was going through my chemo in 2012, my son was getting married in November of that year. So my prayer was that I would be well enough to go to his wedding. And 2.5 weeks after I finished chemo, I was on an airplane to Alabama to go to his wedding. So that was an answer to prayer. And after I did that, I prayed that I would not die before I had a grandchild. And my granddaughter is 9 years old, and my grandson is 2.5. So those are 3 miracles that kept me alive and that I got to see because of prayer and radioembolization. So I'm a very blessed woman, very blessed.
That's wonderful. Yeah, I know, not everyone's religious. I'm Catholic. So whenever patients there's some patients want to pray with me. So I pray with patients sometimes. And I think there's a lot of power in that personally, but I know that's not
absolutely
everyone's thing, but
and asking them, or if they ask you, that's a wonderful way to start any procedure, is to pray with your doctor. Yes. So I don't know. I guess that's it. I've had lots of miracles.
It sounds like it.
You're looking at a miracle. Believe it or not.
I believe it. No, I believe it.
Good.
Well, I want to thank you again, Suzanne, for sharing your story, for being here and educating all us about this journey and the amazing options that you have and your experience, both actually with radioembolization and liver ablation as well for your metastatic colorectal cancer, and advocate that you do through those talks. I can't imagine how many people's lives that you've been able to touch in such a positive way doing that. So I really appreciate your time.
Oh, thank you. I have a lot of time. And like I said, I love to give my talks. I'm on Facebook if you want to friend me, and I can just share one of those talks with you, and you can see what you think, if you think that's something you might want to use me for in the meantime.
Deal.
So, thanks, Dr. Keller.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at @_BackTable on Instagram, Twitter, or LinkedIn. BackTable is produced and hosted by myself, Aaron Fritz, and co-hosts
Chris Beck,
Sabine Dawn,
Michael Barraza,
and Ali Behetti.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles, Josh McWhirter,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz. Social media and PR by Ann Dang,
Manisha Naganathanahali,
and Manbir Singh Sandhu.
Administrative support provided by Judy Dela Cruz.
Thanks again for listening.